Hello everyone, welcome to Lab 6, the veins. So sorry it just froze up a little bit. Hopefully this fixes and I can actually get started. It always turns out that with all the things running at one time here, it seems like it just doesn't do well with all that. So there we go, it's working. So I'd hit a save button here just real quick. So anyway, what we're going to be starting with on this one is our veins, and we're looking at systemic circulation. At the end of this, we will discuss the fetal circulation, EKG, stuff like that as well. So as we talk about this, we're going to discuss real quick that there are two vessels, two parts of the vena cava, two specific divisions. A superior vena cava, and that's getting blood from above, upper half of the body, upper part of the body, superior part of the body. Things like your neck and head, your chest, shoulders, and your arms or upper limbs. The inferior vena cava, that's getting inferior to diaphragm. So that would be all of your abdominal organs and your legs or lower limbs. Okay, so as we look at that, what we'll do is go through each regions here, head and neck. We're going to look, and I'll kind of do like I did last time where I'll discuss the brain veins. And what we'll basically do is we will go down to the internal and external jugular veins. Then we'll go back and do those again on another diagram as well and do these veins. So let's look for the superior sagittal sinus and inferior sagittal sinus. Straight sinus, transverse sinus, the sinuses, which are two of them, they are paired, cavernous sinus, the petrosal sinuses, the sigmoid sinuses, the great cerebral vein, vertebral vein, internal and external jugular veins. So we're going to start ourselves here at the very top with the superior sagittal sinus on the top. It sits in the dura itself. It's a dural sinus. So superior sagittal sinus. Now remember, in anatomy, we don't use words we don't need. If there is a superior sagittal sinus, there's an inferior sagittal sinus. Then the inferior sagittal sinus, we will have, sorry, it's going to make me do this, there is a great cerebral vein that unites with this to form the straight sinus. And when the straight sinus comes back and unites with superior sagittal sinus, we give rise to a couple other veins. One of these is the right and left, the transverse sinuses, and then the vertebral vein comes off the bottom. Now, when the transverse sinus then comes down and takes this S shape, it's called the sigmoid sinus. Now, draining to the sigmoid sinuses, there are the cavernous sinus going to your petrosal sinuses, to petrosals. This is near the petrous portion of the temporal bone. So they're going to come down and help form the internal jugular vein. And the internal jugular vein will go down to your help form your superior vena cava. Now, the external jugular vein, not seen here, but we're going to kind of come back to it in a minute. But basically, as I said, one of the things you'll want to do, and they're about $3 and something at Walmart, is a pack of those little sheet protectors. Now, they've been taken, they have been claimed. I made the offer out, and they have been claimed by someone, so I no longer have those. So anyway, what I want to show you guys here now is our other vessels. And we're going to start with the external jugular veins, temporal, maxillary, and facial veins. So you will see the external jugular here. The internal jugular is coming from the brain downwards, the internal jugular. The external jugular here. Now, both the internal and external jugular can get blood from the temporal veins, maxillary veins, and facial veins, depending on how the head sits. So this is there's a lot of looping here because of the low pressure. That's what's going on. Okay, so as we go through the upper limb, we're going to start backwards. We're going to start with fingers, digital veins, to the palmar venous arches, which are superficial and deeper ones. Now, we are going to see a radial and ulnar vein coming together, and then we're going to see a median antebrachial vein, median cubital, basilic, brachial, axillary, and cephalic. Now, what we're going to see here is, when I teach this, we're going to start with our digital veins and the superficial and deep palmar venous arches. Now, when it comes to superficial and deep palmar venous arches, I will not tag those on the test. The palmar vessels, it will be very difficult on the pictures used for the test to be able to see them. Now, what we want to start off is light blue for superficial and dark blue for deep. So if we come from superficial, we're actually going to see on the medial side the basilic vein going all the way up to here, basilic. Basilic's going to be closer to your base because it's on the medial side closest to your base. So basilic vein runs all the way up here. Then what you're going to see is a cephalic vein closer to your head. It goes up, 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 all the way to here and stops. Then what we're going to be able to do with that is, with the superficials, is we're going to take a median antebrachial and pair that to the basilic here. And we're going to pair him to the basilic here. And then what we're going to do is to connect the cephalic to the basilic is median cubital. Now, as we turn our attention deep, you're going to see on the medial side the ulnar vein, and on the lateral side the radial vein. And these two veins together unite to form a brachial vein. This is backwards to the arteries. Remember, the brachial artery gave rise to a radial and ulnar artery. Well, here the radial and ulnar veins unite to make the brachial vein, and that feeds into basilic. And when it does feed into basilic, we now call this the axillary vein, and it will be that way all the way to here. And then when the cephalic unites with axillary vein, we call it the subclavian vein. Then the subclavian is going to receive blood from your internal and external jugular and vertebral veins, and that's going to make a brachiocephalic vein. The brachial aspect has come up from subclavian. The cephalic aspect has come from these three to make a brachiocephalic vein. So now we will see these a little bit more. Now we're going to talk about brachiocephalics here in the thorax mostly. We'll talk about the superior and inferior vena cava, your subclavians once more, your brachiocephalics once more. We're going to talk about an azygous and a hemiazygous. Now, when you guys look at this, azygous and hemiazygous, they have, and I want to talk about this real, 1 second, I got to take care of something. Sorry, I was getting a phone call there. So anyway, the azygous and hemiazygous. Azygous means it is part of a pair. It's a paired vein. Hemiazygous is half of that pair. So the azygous and hemiazygous will form a pair that we'll talk about. Then we're going to look at the intercostal veins. So let's go here to this diagram and turn our attention to our superior vena cava receiving blood from all this, and our inferior vena cava receiving blood from all this. Now you can see part of our pair. The hemiazygous and azygous are part of the pair. Hemi, half, azygous, so these are half the pair. This is the pair of veins, the azygous and the hemiazygous. Now what's going to happen as well is the azygous and hemiazygous receives veins from the ribs called the intercostal veins. Your brachiocephalics are formed when we take all of these veins and basically unite them together. And so these are some things we want to see on that. Now, we're going to also see in the abdomen the phrenic veins, hepatic veins, adrenal veins, renals, lumbars, gonadals, common iliac, external iliac, and internal iliac. And I don't have the mnemonic for that one. I did get mnemonic about just canned soup and long cans. But this is canned soup great in long cans. And I don't have that here, but let's look at these guys. Starting at the top, phrenic deals with the diaphragm. So coming from the diaphragm is our phrenics. Now what you're going to see is on the right side of the body, you're going to see these veins look very normal, but on the left side, almost all of these veins on the left side attach to the left renal vein. And this is because the aorta would be located right here. Aorta would be coming down here, and that position, the aorta, makes all these have to move further to the left on this individual. So you're going to see that that your vena cava is more on the right. So as we look at this, your superior phrenics, your hepatic veins getting blood from the liver, your adrenal or suprarenal veins from the kidneys, from the adrenal glands. Sorry, it's Monday and I just now got here. The renal veins from the kidneys, the gonadal veins from the gonads, just below the kidneys. Then your lumbar veins all here. Common iliac produce, remember common, what does it have in common? An internal and external iliac unite together to form a common iliac vein. Now on this side, you're going to see your phrenic, adrenal, renal, gonadal, and lumbars, but they almost all attach here to the left renal vein. Okay, so that is a little bit of a difference there, big difference. Now, as we look at hepatic portal system, we're going to see the inferior and superior mesenteric veins, our splenic vein, hepatic veins, and hepatic portal vein. Now, just as a reminder, there's been exam questions that all multiple choice, and there's 10 multiple choice questions. And sometimes I might come in and ask something like which of these veins would be part of the hepatic portal system or something like that, okay? Or which of these would be a part of the circle of Willis, which of these, and I will point to those as well. And it's mostly identification. There's 40 identifications, 10 multiple choice. So as we go look at these, let's start with the mesenterics. Because they're in the mesenteries, the membranes that hold the intestines together, there is a superior mesenteric and an inferior mesenteric. And then splenic to drain the spleen. These three unite together to produce a hepatic portal vein, which brings all this blood to the liver. And then from the liver, there's a set of veins called the hepatic veins that get that blood into the vena cava, take it to the body. So this is how we can get some of that material from the liver, like liver proteins, things like that that get picked up by the liver, and other things like that the liver produces. Now, a few things I do want to mention here clinically, especially there's two veins of the hepatic portal system I want to mention clinically, is the inferior mesenteric vein. A lot of times if you have increased intra-abdominal pressure, like through pregnancy, or let's say somebody is a long-haul trucker and they sit with their abdomen bent a lot, and a lot of pressure you get what is called increased what's called a hepatic portal hypertension, portal caval hypertension. This pushes down the blood into here, and it will cause a pulling of blood into this, which causes an accumulation of interstitial fluid in the rectum, which causes hemorrhoids, or an increased fluid and pressure of the spleen, which causes splenomegaly, enlarged spleen. So these are two things that can happen due to pressure of the abdominal area increased. So with a pregnant female, something like that. Okay, I have done a little drawing of this to help you guys kind of navigate as well. Now, the lower limbs is the hardest part. As we work our way from the toes up, this will be the most difficult section for this lab, and I think it's the most difficult section of them all, is the veins of the lower limb. The digital veins, we're going to see they come up to produce dorsal venous arches and plantar venous arches. Now, our anterior and posterior tibial veins, we're going to see they're unique. We're going to see the fibular veins. We'll see how this goes in to help form things like popliteals, and how when a small saphenous versus great saphenous and how they form in femoral veins and deep femoral veins. Now, like I said, I could come in and say which of these veins are in the lower limb, something like that. It could be a question in a asking on a test, so just let you guys know. So as we start at the toes, we have digital veins that unite to come in and attach themselves to plantar and dorsal venous arches. Now, I am not going to put plantar or dorsal venous arches on this exam. It is too difficult to tell when I make the diagrams. Now, as this blood comes up, one of the veins you can produce is called the anterior tibial. It starts on the front of the leg, passes between the fibula and the tibia, and goes behind it. Now, another one that we're going to see here is called the great saphenous and the small saphenous. Now, we want to kind of pay attention to these. We're going to use small saphenous and the anterior tibial vein as a landmark for over here. Now, here's our anterior tibial vein coming to the top. Here's our small saphenous coming to the top here. Now, with the anterior tibial vein and the small saphenous between the two is the popliteal vein. Now, the posterior tibial vein goes up to help form popliteal. The fibular unites with it. Then the anterior tibial unites with it. Then we call it popliteal. Then your small saphenous unites, and we call this the femoral. The great saphenous unites on the femoral, and deep femoral unite together. We still call this femoral vein till it makes your external iliac. Okay? Now, most of these will be best seen here. I will have both views on the exam. And these will have to be in grayscale, so I will tell you that they are veins. I will say name the vein, or I will let you know they are veins, because it'll be in grayscale. We don't on this. I'm allowed to make prints in color, but not color copies. We don't have color copies, and they wouldn't let me print out as many to each give you guys your own booklet. Now, as you go through these, like I said, the best way to learn these, now I do have one of those left. The student who took them let me keep, they took 49 of them. And let's see if I can find the one that I got. But maybe I don't have it now. Maybe they did take them all. I don't think I have any of them. Sorry, I thought I had one. Is getting those sheet protectors like I showed you guys, and actually put these blank diagrams at the end in them, these things here, the arteries and veins, and label them. Now, I've left these lines. I've had students in the past say they prefer to have the lines on there because the ones they need to know, it's easier for them to know where to write. And then I've had students say, just give us the blank ones, we can label them ourselves, and that's what I'm going to be doing. Some of you have emailed me about it, and so I think overall, especially considering that I'm probably going to be doing more of these online classes, that it is better, especially for the online students, it's better because you don't see me as much. But these are great ways of practice. Is stick these in a sheet protector, write on them with a dry erase marker, get the small ones, or you can use something like this, like these right here. The small expos work great, or even vis-a-vis expos. These will wipe off with wet. They're dry. It's not dry erase, but it is wet erase. These are used for. These were used in the old overhead projectors. Sometimes I like those as well because you can wash them off. All right, so what we want to turn our attentions to is you guys study those and get those. It is the students, how much you study it will get that to stick in your head, okay? Now, I've been wanting to put together a drawing for fetal circulation for some time. I don't have one done yet. I have some things I've attempted to do. I thought they would be in this stack. There's like somewhere I have a little pack where I've been working on some, and actually been wanting to do a YouTube video on it for some time, but I haven't really gotten it where I want it, but I've kind of built something, and I was like, where do I have it? And I know I have one done somewhere that I've started, but I was like, I really thought about doing a challenge out there is to get my students to do one. And so what I was going to do is give you guys an extra opportunity for your 5 replacement points for the overall lab, is, and you can bring this one to the lab part of the exam and drop it off for me. And so I just said this one, I'll get you guys involved in it and see if you can actually help me create something. And then I'll feature that in a YouTube video, is to basically come up with a simplified drawing of fetal circulation, something not that complex. Let's say you're just drawing lungs and things like that, somewhere along these lines. And you're drawing something like that. And what we're trying to do is get the uniqueness here, but also research it a little bit about the blood concentrations. I'll give you guys some good hints here on some things to get you started, but I wanted to offer this as an idea I had, is there is some good drawings that I've seen here. Here is one that I've looked at that I'm kind of trying to mimic a little bit of. And there's another one I've seen here as well that I liked a lot. But this is one that's kind of good if you want to kind of borrow a little bit. And this one here is one that I've also seen that I like a little bit. If you wanted to try to do, it is, if you wanted to check it out, they did a video on it, but I don't want to use identical to theirs, but if you want to try to make something like this and come up with it, please do. These are just a few ideas. I want to kind of give you a start and an idea of something you can make. But just research it and see if you can find some decent, making it like this simple right here is perfect. I want it simple. And see if you can also, but basically you're helping me too, but you're going to get yourself some extra points. And I wanted to give you guys that option there as an extra one. All you got to do is bring it with you on the next exam after spring break. They'll give it to me when I go pick them up after that week. Now, the placenta, this is important. This is the area where all the exchange happens. All exchange between fetal and maternal blood occurs here. That's where nutrients, wastes, and gases, your oxygen and CO2, gets from mama's blood to baby's blood, and from baby's blood to mama's blood, fetal blood to maternal blood. Okay, so it is this backwards thing here. Now, to make that, there's an umbilical cord, and the umbilical cord has 2 vessels in it. The umbilical arteries, now here we have an artery is always away. Whose heart is it away from? Baby's blood, baby's heart. It's away from the baby heart. Now, the umbilical arteries, blood enters the umbilical cord from the baby, from the internal iliac of the fetus. So this is going from fetal heart out, and this takes blood to placenta. O2 poor, CO2 rich. Now, all you have to do on the drawing is include the gases here that I've got, okay? And I would ask you to try to do that. See if you can do a simplified line drawing. I gave you 2 good starting points there. Now, what happens is the umbilical arteries carries blood to placenta from fetus. So this is away from the heart, but fetal heart, and it's O2 poor, CO2 rich. Now, this after you're born and these die off, the connective tissues are left, and these are your lateral bladder ligaments. So, as in the grown-up individual, in the after birth baby, after some time, you look on the side of the bladder and you'll see these. The umbilical vein, this carries blood from placenta. It goes to the umbilical cord to the fetus. So this is from mama to baby. So this goes to the baby heart, here. This is O2 rich blood. So arteries and veins in the fetal circulation are much like the pulmonary circulation. Arteries are O2 poor, veins are O2 rich in fetal circulation, like it was for the your pulmonary circulation. It's another place where it's backwards to systemic. Okay. Now, what happens is this goes into what is called a ductus venosus. That goes into the inferior vena cava. After you're born, the ductus venosus is actually what becomes the round ligament of liver. Now, the umbilical vein, it's not really the full umbilical vein that does it. It's part of the umbilical vein, the ductus venosus, if you want to be a little more accurate. But now, there are 3 shunts. I ask that your drawing includes these 3 shunts. Ductus venosus, this is your umbilical vein, goes into the inferior vena cava to allow blood to bypass the liver. Why? Baby's liver is developing but doesn't need to do a lot. It isn't metabolizing, it is making some proteins and doing the other liver things, but it's not really needed to do as much. It doesn't need to metabolize. Mama's liver does all that. So what we're going to do is we don't need to get as much blood to the liver. We bypass it and shunt or bypass it away from the liver. That's what ductus venosus does. Ductus venosus is the liver bypass. Foramen ovale, remember, is in the interatrial septum. That allows blood to bypass the lungs, so because baby doesn't need to breathe. And this is what we call patent foramen ovale, is when you're born with this, after you're born, about 6 months, this closes down, or 6 months or so, it starts to close up, becomes a fossa ovalis. If it doesn't, we call that a foramen ovale that failed to close. So it's patent. Then if it's a ductus arteriosus, what we have here is this takes your pulmonary trunk and vessels, pulmonary arteries, to the aorta, and this allows more blood to bypass lungs. Baby isn't breathing. We don't need much blood to go to the lungs. So we're going to shunt blood away from the lungs and get it to the body. Again, only a little bit of blood goes to the lungs. Don't need much, enough to keep the lungs alive, and they can grow and develop, but you're not breathing, so we bypass it and use that blood elsewhere for our growing, developing body. And that's why we want to bypass a lot of these things. We're going to let our liver and lungs develop while our bones and things like that are forming, and some of the other organs are forming who need it really intensely. So it's basically these 3 shunts. So I want your drawing to include these: the placenta, your umbilical arteries and veins, your ductus venosus, foramen ovale, ductus arteriosus, and I want it to include O2, CO2, and nutrient content when discussed. Just help you guys get it, but if you help me design it, I'll feature it and mention your name in the YouTube video as the person who helps me. And if you like, I can even bring you as part of that. You can actually help me make that video if you like to. I'll bring that out. It's just you're the only class that's going to get this opportunity, so I just wanted to offer that out there. Nobody else is doing it, but this is a big topic here, and you can see this. Now, you're not going to have to identify these things. I do ask multiple choice questions on it. Probably at least 2 multiple choice questions on fetal circulation out of the 10. All right, EKG. There will be 1 question on this. Specifically now, let's talk about this. This is telling me the electrical activities of the heart that is related to the contraction of the heart. It's useful as diagnostics, helps us tell if the heart has irregular heartbeats and other problems. The EKG is the machine. Why is the EKG ECG? EKG is the German. Cardio, K for German. German, ECG, English, EKG, German. The printout is called an electrocardiogram. Now, what I want to do here, and I do need to do one thing, is, well, I can't do it now. We drew this out in lecture. I won't draw it out again. Is the different waves. The P, Q, R, S, and T are the different parts of it. Now, the P wave itself says the atria have depolarized. They're going to contract. QRS and the ventricles depolarized. Ventricular contraction is going to happen, and it happens right after the R wave of the QRS. So right in the middle, the ventricles will start to contract midway in. The T wave is ventricular repolarization. So I will ask what each one of these things represent. Okay? So here's your typical EKG tracing, the one we also saw in lecture. Now, blood pressure. I do want to mention a little bit about this. Blood pressure, how much does a volume of the blood that you have in your blood vessels exert force on the walls of arteries as it moves? We measure that. We use a stethoscope and a sphygmomanometer. The sphygmomanometer has a cuff on it. You inflate it. It squeezes down on usually the brachial artery. It measures in millimeters of mercury. We're measuring how many millimeters we move a column of mercury, liquid metal, which at least is the unit. We don't really move a column of liquid mercury anymore. We use alcohol or a dial. And as that moves, it's just above your elbow, over your brachial primarily. We measure that. We pulsate it up, and then as the arteries pulsate, we get our systolic versus diastolic. Remember, systole is when the heart squeezes. Anytime a heart chamber squeezes, blood leaves it. Now, systolic pressure is how much blood, that's the maximum. That's how much is being exerted at max. And what I wanted to do there is fix that before it always bugs me when I leave things like that undone in my notes. And it's just a thing that bugs me. So systole, when it contracts, that's your maximum exertion. And it's about 120 millimeters of mercury, or close to it. Like I said, will it be perfect? No, but it should be very near. Sorry about that. I wanted to do that now because if I don't do it while I'm looking at it, it won't get done. While I'm thinking about it, I'm usually teaching in a classroom, and I don't have that ability. After the heart contracts and then the chamber relaxes, the artery walls relax as well. This is called diastole. The force of the arterial walls also drop down to about 80 millimeters of mercury of pressure. So we always give systolic over diastolic at about 120 over 80 for normal. This can be higher or lower. Your body will stop seeing it. Remember we talked about the baroreceptor reflex. If it is constantly high and the arteries are stretching, being distended, and the baroreceptors are being stimulated too much, eventually the body sees that as the new normal and no longer tries to lower it. And you get to the point where you can't reduce your own pressure over the long term and have to go on medications. Now, if it's over 150 over 90 consistently, it's called hypertension. You can't have just 150 over 90. That is a hypertensive measurement. That is high. Hypertension, though, if for somebody to say that you are truly hypertensive, you want to consistently have these greater than 150 over 90s, consistently multiple times. A lot of times, sometimes people get white coat syndrome. Theirs goes up. I think I have reverse white coat. Is that my doctor is a very soothing, calm man, very calm individual. So I think he actually puts me at ease. So my blood pressure may be lower when I go to the doctor's office than maybe it normally is. So a lot of times they will have you measure it outside. One of the ways you can do this is go by your pharmacy. Most pharmacists are trained in doing this, checking it as well, which You go in, yes, they pretty much instantly do it or very quickly do it, instead of where you're sitting and waiting, getting angry, waiting in, or nervous and stressed. Hypotension is less common. It's abnormally low pressure. Like if you're bleeding out, you can end up with that. Drugs can make people become hypotensive. Now there are four sounds in the heart that we can hear through cardiac auscultation. Through auscultation, I will ask this in lecture, and I could ask this in lab. It will be on the lecture test for sure. Could be on the lab exam. There are four. S1 is when the AV valves close. That's your lub. S2 is when the semilunar valves close. And that means your ventricles are filling. When the AV valves are closed, the ventricles are contracting. And when the AV valves close, when the semilunars close, that's when the ventricles are filling. S3 is blood flows in the ventricles. And S4, atrial contraction. Normally never hear these. Maybe very difficult to hear both of them only when there's problems like intraatrial septal defects, like open foramen ovale, interventricular defects, valve defects. Now, heart rate is measured. How much blood is being pumped in a minute? You can measure it here, of the skin, especially carotid, radial pulse, things like that. And respiratory rate is just measuring the rise and fall of the chest in 1 minute. How many times we breathing is something else we also look at. These are your vital signs, the very important signs we look at. So your study guide, again, always define these things. These are terms you need to know, be able to describe them, know where they are, list branches, things like that. Study this stuff, define them, make sure you know what they are. Make sure you guys, now I could have a heart wall diagram on the test and ask you what one of those things are. This is not on the exam here. This is not on the exam. The rest of them are. Pretty much every diagram will be on the test. Every diagram is on the test here. Every one of those, okay? Now, it is the heart models that will be on the test. Also take these and put these in sheet protectors, practice labeling them. Now, if you have not noticed, if you go into D2L of my course, and you go into here and go into content down here. Now, I did it in the lab. Now, I've got to build a few more things for your next lab, as I have the heart models labeled that you can also study there. Now, I don't have arteries and veins jeopardy. I just have the heart jeopardy. I've never made an arteries and veins jeopardy yet, but those are extra things to study with. It's like a little quiz game. Now, but I recommend that you take advantage. So this is how you can check yourself, is by downloading this document as well and check yourself, and take these diagrams here, put them in a sheet protector, practice labeling them, check yourself, okay? Or what some students do is they print this off and they just take Post-it notes like this. They'll take a Post-it note, maybe they'll get a small one or a half one, and they'll stick it over it and can write their name, and then they can check. It's another thing people have done before in my classes. So now, what I'm going to urge you guys to do is, as you study, is to practice this. Over spring break, practice this. My students, one spring break, turned this into a drinking game. They got together at a party and studied for my anatomy exam, and they turned that into a drinking game. I don't know how they did it, but they never told me. But hey, whatever you got to do to make studying fun. But get with other students and study. Please go see the tutor. Contact Renee. She is going to be tutoring over spring break. So if you guys are available over spring break, please do. Now, please note, spring break next week, there is nothing. It is a week off for you as well. There is nothing you have to do, okay? So you have nothing next week. I will be recording next week and be in a little bit. And what I'm going to Sorry about the sound. We are right next to the, my office is literally next door to the airport. Then I'm going to do a video on how to get your exams in the testing center. The different times are here, things like that. And I'll do a video on how to make that. But again, if you've never done it, go to course documents. Here is how to actually sign up for the exams in the testing center. You'll come and take them on paper just like the old one. I am preparing and making some changes for future of this course, which I'm excited to get to do again. I actually rather, I love teaching AP2. It's one of my favorite courses to teach. I love the content. But I wanted to kind of give you those last bit of things. So please take time to redraw this, practice it. Make these little study sheets, put them in all these diagrams into a little sheet protectors. You can buy a pack of 25 at least for $3 at Walmart. Pretty cheap, pretty inexpensive, really cost-effective method of teaching, or studying rather. So guys, thank you so much. I really hope that this helps. Enjoy your break next week. Do take it. Now, if you want to use that for some studying, I can't stop you. And I definitely urge you to study some. But enjoy yourself. Take a break. But also get some studying in. Go in there and prepare for that exam. Excel on this one. This is one of those exams. The first exam in this lecture is always the hardest. The second one is one where the students really take off. And I like to see you take off here, okay? Trust me, I wouldn't be putting all this extra effort to make sure I can do these things if I didn't want you to be successful. So guys, thank you so much. I really hope things go well. Enjoy that break. And I look forward to talking to you guys in the next one. So thank you so much.